Hello dental friends, I hope you're well. I've been absent for a little while now and I've been working in a MaxFax department at Luton and Dunstable Hospital. That in itself probably tells you why I've been quite absent. It's a really intense job. But since we're at the point where we're choosing our DCT1 or DCT2 options, 7 days from now actually, so get hurrying if you've not done it. Since we're at that point, I wanted to talk to you about what I feel like I've gained from my MaxFax post and why I would recommend most people doing one. Just to keep things fair, I'm going to be releasing another video tomorrow about what I don't like about being a MaxFax DCT. Let's get started. I have been sitting on that intro for a year, but I've just had no time to make videos because of this job. Honestly, it really is that intense if you're in a busy unit like Luton. Oral maxillofacial surgery encompasses things like facial swellings, facial fractures, head and neck cancer, severe dental infections, and most other things encompassing the head and neck, to be honest, anterior to the tonsils, which is posterior to that is kind of ENT's area. And if you're like me, you're probably thinking, what do I have to contribute? I'm not a doctor, I'm a dentist. I haven't done much outside of the mouth, so how am I going to be an asset here? One of our consultants at the induction said to all of us, remember, you guys are the experts of the head and neck. Don't forget that. We all laughed kind of uneasily at this point, being like, okay, Mr. Sharma, just thinking, does this guy know who he's got here right now? The thing is, you then start to realise that doctors actually have quite a large gap in their training where the head and neck is concerned. They do ENT placements, but they don't really do any MaxFax as far as I've heard. And given that MaxFax is a specialty based on dental-alveolar principles, it's kind of our remit, so we kind of know what we're doing, even if we don't know it. One quick example, just to tell you about the different ways that we think from doctors, for example, is I was asked to come to A&E to review a patient who'd been involved in a road traffic accident. A&E had triaged her, they noticed that she was missing some teeth and she had a lip laceration, and asked me to come have a look at her and treat her accordingly. They also told me they'd requested a chest x-ray just to make sure that she hadn't swallowed any teeth. I walked down, do the old Dr. ABC, check the patient's stable and take my history. Then I get my trusty torch and I take a look in the mouth, because obviously that's my comfort zone. The patient had a dental-alveolar fracture and the upper right 1 and 2 had been completely intruded beneath the level of the alveolar ridge, so it didn't look like there was anything there. But if you had the training and you had the light and looked in the mouth, then you could see the crowns quite clearly, so you knew she hadn't swallowed them. I did tell the patient I didn't think she'd swallowed them, and she was like, I knew I hadn't. I kept trying to tell the doctor this, but she wouldn't listen. I went to tell the doctor that the patient hadn't swallowed her teeth, and the doctor said, oh, have you seen the x-ray then? She felt more confident diagnosing whether a patient swallowed her teeth by taking a chest x-ray than she did by looking in the mouth, because she hadn't actually really looked in any great detail. I'm not saying this to shame the A&E doctor, because obviously if it was something medical, I would need a lot of support just like she needed from me. I just wanted to illustrate how much of an asset you actually are in an A&E department, for example. On to the benefits I've received doing this job. The number one thing for me is confidence. After you've treated or been involved in the treatment of patients who have swellings that look like this, or lacerations like this, or fractures that look like that, you're not really going to be too scared treating dental things in the future. Last year I was stressing out about root canals, and now I've not picked up a handpiece or done a root canal in 9 months, for example, and I feel completely confident to sit down and have a go at it, because what damage could I do, realistically? I've treated much worse with much less sleep. I also think my surgical extractions have improved massively, and it's not necessarily because of practice. I think I've only done about 4 or 5 real surgical extractions with raising a flap and removing bone, but I have that confidence because I know the anatomy, I've seen them done a lot, and I feel like I could have a good go at any tooth realistically. With the experience I had now, even if I went back to general practice and I accidentally completely cut a patient's lip in half with a burr, it wouldn't make me a very good dentist, but I wouldn't bat an eyelid with regards to how to manage it, because like I said, I've dealt with worse, and I really think that confidence I've gained as a clinician is going to serve me well no matter what I do moving forwards. The second benefit is having access to experts in the field. As most of you know, dentistry is not really something you learn from a textbook, it's something you learn by practicing on patients, getting feedback by seniors, and also by reflecting and repeating the process. If you're a general dentist and you have an interest in bonding, you pay for a bonding course, for example. If you have an interest in oral surgery, you could pay for a course, sure. However, if you want to improve your surgical skills, being a DCT, you're around these experts all day, every day. You can ask as many questions as you want, And there'll be times where you'll have a consultant watching you and guiding you through a surgical extraction, for example. Imagine how much you'd have to pay to have that privately done on a course. As a DCT, you have access to these people, and this benefit is amplified massively when you're in a unit that's very dedicated to teaching, like mine is at Luton Dunstable. The next benefit is you'll know what a MaxFax department actually does. You'll be able to assess lesions which look sinister and refer them much more confidently. You'll recognise soft tissue growths that are benign, TMJ disorders. You'll be a lot more clued up on how they're actually treated, and you can advise your patients accordingly. On top of that, if you're in practice afterwards and a patient comes back with post-op bleeding or with a dental swelling, you will be the go-to guy or girl, and it's nice to be that person. It's nice to be such an asset. The experience will also make you a much more holistic clinician. You'll recognise all the medications they're taking, you'll know why they're taking it, you'll probably know what doses they're taking half the time. You know what other departments in the hospital do because you will have worked with them before. Your head and neck anatomy will also improve massively, and the same consultant I mentioned earlier always says that anatomy is the language of surgery, and once you've improved your knowledge in that area, you'll feel way more competent as a surgeon. The final thing I want to say is that it is an exciting job. There's people who love MaxFax, like me. There's people who hated MaxFax, even people who've dropped out early. But I think you'll be hard pressed to find somebody who works in a busy unit who won't say that it isn't exciting at times. Maybe I'm a bit weird for this one, but there's something really exciting about when you're alone in the hospital, it's 3 AM, A&E call you because a patient's got a split lip and they're pouring blood everywhere and they need you and you're the only MaxFax doctor. Oh, that just gets my adrenaline going. I don't know why, but it really does. Don't get me wrong, it's absolutely terrifying at times, and sometimes I feel way out of my depth. But like I've always said, life begins at the end of your comfort zone, and it doesn't really get much more uncomfortable than this job. That's it from me. I really hope that helps give you a bit of an idea about what you can expect if you do MaxFax next year. Tomorrow, I'll be releasing a video on what I don't like about being a MaxFax DCT, just to even the scales a little bit. I'll see you then. Take care.